in the Senate, which would have extended the statute of limitations for child molesters. And what that means, it really would have extended the statute of limitations for the victims. And you're talking about a child has until the age of 23 to be able to take action. If the child was molested while they were underage. This bill would have extended it to any point in their adulthood. They would have a 1-year window from the point of initiation to be able to file a notice of claim. So it was blocked. I guess I don't understand. And the beauty is that Assemblyman Brindisi is a part of all of this, and he's an attorney, so maybe he can give us a little bit of insight on all of that. Also this morning, for the first time in studio, Stephen Wells will be in studio this morning. It looks like it's going to be in the 8 o'clock hour?
Yes. Yeah, he's going to be in Rome today, so he's going to stop and check with us first. All
right, back to the story at hand. Our phone number is 736-0186. I think it's the story at hand. It's the biggie today. When these 3 pediatric groups, and Christine, you're saying, I understand what you're saying, that they're saying there's nothing wrong at the Mohawk Valley.
They're not
hospitals.
leaving because of the quality of care. That's what they are saying.
But the letter says they are. And do you have the letter right there? I didn't bring mine in. The letter specifically says, this is the part where this is contradictory. And I'm sorry, I can't buy it. I think we deserve answers from the hospital, and we deserve answers from each of these doctors. Because the letter says, this is for the care of your children, not the finances of the doctors or the finances of our facility. It's because of the care of it. Your children will receive better treatment. I don't know how you can read that in the English language and say that doesn't question the care that these kids are receiving at the hospital. I don't care what they say until somebody comes on and gives us the real answer here. And I think I'm really bothered by this. And you know, for instance, think about the parents like us who live in the Valley. It now means that instead of traveling to Utica, we're traveling to Syracuse. But it's beyond that. I'm concerned that if they're not trusting the hospitals here, we need to know why. And is it about copays? Is it about finances? Is it about payout? Is it anything to do with financial? Because that would certainly set everybody at ease. But if it's about care, I think people deserve to know. And this does come at a time when you hear, and I can't ignore this, when you hear medical officials, people that work in those facilities saying they are understaffed and cannot perform their job. So is that the reason? Or is it because of the staffing issues? And Christine, I don't think we can hold any punches here today. This is about the care of your children. And we're getting a letter that's somewhat vague, and then we find out nobody wants to talk. I mean, am I the only parent out here that is upset about this and curious for a very important reason about the well-being of our children and their care?
And I don't know that this has anything to do with it, but another big thing going on with Mohawk Valley Health System now, and it's been going on for probably about a year, you're starting to see it come into the public eye a little bit more. Signs about the labor disputes and contract negotiations for nurses between Mohawk Valley Health Systems and their nurses. Well,
one thing we know is that it certainly seems like that emergency room is understaffed. I know of a story where someone went to the emergency room this week and spent 8 hours sitting in that emergency room only to be taken care of at 1 a.m. for about 4 minutes, and a guess was made, a guess diagnosis, and they were sent home incorrectly diagnosed after waiting 8 hours. So, and I understand in an emergency room, it is about, you know, if someone comes in with a bullet, somebody's in dire straits, obviously you're treated based on the severity of whatever you're there for. But at the end of the day, 8 hours, and they see you for a couple of minutes and they send you off and misdiagnose, that's ridiculous. And is that staffing? If you talk to a nurse, that's exactly what it is. And meanwhile, today, and I understand that that's this whole new hospital project is all about, but today, if you read in Syracuse, the Syracuse Post-Standard, they're at a record profit margin this year. Syracuse hospitals are at a record profit margin this year. I don't know that we can say the same thing about our hospitals here. So here's the question. Why has this happened? What is it saying about our hospitals? If it's financial, I guess that makes people feel a little bit better. But if this is a vote of no confidence by these doctors, I think the parents whose children are going to these facilities deserve to know what the story is. We'll take your calls on it. 7360186 629. Christine has news coming up on WIBX.
A lifetime of service to our community as a judge, county leader, and civic board member, attorney Robert Julian is one of the most acclaimed trial lawyers in Central New York, representing people, lawyers, and judges.
I'm Bob Julian. The courtroom is my workplace. It's where I represent seriously injured people who need a lawyer to stand up for them.
If you are seriously injured, call the law office of Robert F. Julian, a trial lawyer for serious cases.
Call 797-5610.
It's back! Run, bounce, and slide your way through the craziest fun run you've done.
The Insane Inflatable 5K. Get your bounce on at our new location, Griffiths International Airport in Rome, July 16th. Get your team together and register now at InsaneInflatableShop.com. It's going to be the biggest fun run of the year, the Insane Inflatable 5K. Saturday, July 16th at Griffiths International Airport. Sponsored by the Home Ownership Center, McDonald's, the U.S. Army, Hannaford, and the Army National Guard.
This is First News with Keeler in the Morning on WIBX and WIBX950.com.
All right, 6:30. Christine's news coming right up. Sandy standing by on the phone line wants to pipe in on the pediatric situation going on here in the area. Good morning, Sandy. You're on the radio.
Hi, Bill.
So what do you think? What's your take on this?
Well, I work in the healthcare field, and I'd like to shed a little light on the situation as far as what I see.
Yeah.
And that is that there are a lack of pediatric surgeons in this area, and I think that that's a large part. And also, there are a lot of primary doctors that are not admitting their patients to the hospital. We have a hospitalist program, and the hospitalist will admit the patient. All the records go to the primary doctor, and the primary doctor will follow up after the patient's been in the hospital.
Right.
So I think that those are two large parts of their decision. I don't think that it's necessarily a problem with staffing or incapable doctors and staff.
So, what I hear from people that work in the industry is they are so understaffed that they're running ragged, and it's almost impossible for them to take care of everybody. Would you think? Do you agree with what those people say?
I do agree. I think sometimes there are short staffing situations where it is difficult to take care of the patient load that you have. But I do think that the hospitals, or both hospitals, I should say, are trying to improve that situation.
Yeah. And Sandy, can you understand how, listen, my daughter's been going to Utica Pediatric since she was born. And we love it there, and we really trust those physicians. You can see how, as a parent, we would be concerned. And the first thing a parent's going to think is, oh, my God, our kids are not going to get the level of care they need at our hospitals. And, it's the age-old thing we've always heard, get out of town. That's what people are fearing today.
Yeah, absolutely. I agree with that. If I had kids that were going to these pediatric offices, that would worry me.
Yeah, all right.
If you have an emergency, you don't want to drive an hour to go to the emergency room.
Correct.
Well, and they're
I think
saying
that they need to try to recruit more pediatric surgeons and see where we're falling out, and see if we can improve it in this area so we don't have to take our kids out of the area.
Right. All right. Listen, Sandy, I appreciate that. Thanks so much. Hopefully, the new hospital will resolve this problem. We hope. That's really the big hope that everybody has. Sandy, thanks for the input. It helps a lot.
Thank you.
All right, Christine, let's do the news, and we'll come back and talk about this. 6:33. Here's Christine right now.